Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another YDC podcast, Real Talk podcast. Today with us, we're very fortunate and blessed to have a very well-known guest, Dr. Imran Versi. Should we put Sheikh as well? Sheikh Dr. Imran Versi?
Just the doctor is fine.
So Dr. Imran Versi, mashallah, he has a very well-known, very rich and filled biography. He's done so much for the community, and we're very fortunate to have such a member in our community, alhamdulillah. So just a bit about him. He was born and raised in Dar es Salaam. He is a doctor who studied in KCMC. He did his MBBS, MD, 5 years in Moshi, and currently he's pursuing psychiatry. He's doing his psychiatry residency in Nairobi in his final year. And he also studied in Hausa for about 1.5 years in Qom, in Jamiatul Mustafa. So I think let's get to know more about him and let's welcome him. Welcome so much, Dr. Imran.
Thank you so much. That was flawless. Mashallah. Thank you. It's an honor. It's a privilege for me to be here. I've actually seen some snippets of YDC's previous 2 episodes, I think. One was with Maulana Nusrat and the other one was Dr. Alyaska. So I've seen a few of those snippets, and it's an honor, and I'm really happy to be here. I mean, mashallah, Arusha's YDC's budget is quite high. They're serving real tea, and I don't know what illegal business is going on behind the scenes, but mashallah, it's an amazing setup. So thank you for having me. Thank you so much.
Alhamdulillah, thank you so much. We feel really honored. I also didn't mention how much of an influence and how much part you're actually taking in the community. You recite majlises. You're a Quran competition champion, Africa Federation, Dar es Salaam, more than 10 times. You teach Quran, mashallah. You're a role model to most of us, me personally. Okay.
I appreciate it. Thank you.
And then duas, marshas, matam. What don't you do, mashallah? Like you are an all-rounded, perfect figure.
Astaghfirullah. Nah, this much fazail, I've never heard of myself. No, but we try. I try to... Yeah, in Nairobi, I do recite a couple of majalis in the Imam Bargas, in the various centers, Hussainiyas that we have. It's difficult for me right now because I try to give back to the community whenever I have time, but it's difficult. As you know, you're a doctor, with work and masters and then extracurriculars, it's very tedious. And then with Hausa online as well, there's no time really.
So you're continuing your Hausa, mashallah.
Yeah, I am.
So I think this is something that is very key. Maybe we can start on this.
Yeah.
What do you think caused this? What inspired you to do all this for the community? Being a doctor, studying Hausa, serving the community, doing all these things. Then, mashallah, you're managing your time so well that you're able to do all these things. What would you say inspired you? From such a young age, you've been doing this.
So to start with the medical part, alhamdulillah, I was fortunate. Not to be, many people are confused in their lives, especially after Form 4. People don't know whether they should take science or arts or what field would suit them. Alhamdulillah, it wasn't the case for me. I think from a very young age, I had decided, and it was ingrained in my mind, that medicine is what I want to do. So there was no 2 ways about it.
No doubt.
There was nothing like engineering or pilot or finance.
Hausa,
yes, it was a very integral part. And I remember having a conversation with my dad, and he sat me down and he told me, look, it's better for you to have some sort of secular background. And then if you are truly passionate about Hausa, you'll go after. And it stayed true to his word. So after I finished my medical degree, I did my internship at Muhimbili and then worked for a year, and then I went to Hausa.
mashallah,
So it worked out, alhamdulillah, yeah.
So I think also comes down to upbringing as well, like having the family support, like you mentioned. Your father was there, he supported you, he told you.
Yeah, of course. My parents have always been supportive with whatever decisions I've made, alhamdulillah. I'm blessed, truly.
So when you started this medicine and then you finished medicine, I'll just jump to this part first.
Yeah.
You went straight to Hausa after working 1 year.
Yes.
So you worked that 1 year, you saw what the medical field is like.
Yes.
And then you still felt like, I should go explore what Hausa is like.
Because that passion that fire still remained the same.
So how did you keep up? So, for example, most of us, if we're in school or in university, how do you keep up with the Islamic knowledge, and how do you manage to make sure that, I'm up to date? Is it just majlises? Do you read a book? Have that fire, that
I
love
think,
for.
yeah, I think seeing my dad as well recite majalis, being fluent in Arabic, these are aspects of. So I'll give you. I remember one very vivid incident that really pushed me to learning more. I remember whenever we used to go to the Imam Bargas or private majalis centers, and when there was Yasin and Harith Kisa being recited, I remember I always used to play with my phone. There was this one instance when Yasin was going on, and my phone, the battery in my phone had died, and so I could not play anything. And I'm looking around, and I'm thinking to myself, well, the Quran is going on, I don't know the meaning, and I'm trying to look for distractions. So that night when I went home, and one of the first videos that popped up was learning and understanding the Quran, etc. And when I opened it, and I think that point, it was like a turning point for me to try and learn as much as I can, which is why I went for my certificate in Arabic and then Farsi later on, etc.
So you learned Arabic and you learned Farsi before going to Hausa?
No, so Arabic was before Hausa. It's a place in Dar es Salaam. It's called Ma'ahad Lughati al-Arabiya fi Tanzania. So yeah, so that was during my internship. And then Farsi was in Qum, because Farsi is very difficult to learn here. This was after KCMC.
So during KCMC you were studying medicine, which is quite a hard career.
Yeah.
Would you do something else as well, like Islamic studies, kidogo here and there, read a book maybe, watch some majlises?
Yeah, during the 5 years, there's a lot of videos, because, medicine, as you know, it's very tough.
You need distractions.
Yeah, you need those distractions through FIFA or through watching, be it Islamic videos, etc. So we had a very good group of 4 to 5 individuals. We were staying together in one house. Famously as well, you have Dr. Aliasgar Mukhtar, who's from Arusha. You have Dr. Jahankir Sharif from Arusha as well. Dr. Mujahid Manji, everyone's a doctor. So we were all together with other 2 doctors from Dar es Salaam as well. So it was quite interesting. That bonding, that brotherhood was quite evident. I think that's what kept us going, because, coming from Dar and then going to Moshi, I've never been to Moshi before. I didn't know anyone. So, and everyone most of them were years above me, in front of me. So it was quite, they really helped, in pushing it. And it was a good environment.
How did they help?
So I remember one of us used to make one of our housemates as a dummy, and then we do a clinical exam on them. We used to have house discussions. We choose a topic. Let's say today I'm presenting on tuberculosis, so I'm going to present on the pathology, pathophysiology, treatment, etc. And the other housemates would now ask questions and chip in, and so it really and of course I got free books, because like 3-4 of them were already there, so I didn't have to buy any book, physiology, anatomy, nothing. I got all my books for free. I was supposed to return it to them. I don't know. I still have them, I think. Yeah.
They're probably watching.
Yeah, they're probably watching. That's okay. That's okay.
So when you're studying medicine, the first starting of medicine, like you said, you are already decided that I want to be a doctor.
Yeah.
But when you start medicine, the things you see is not things that you'd have seen before.
Of course.
Like there's an autopsy kind of thing you do. You'd
cadaver.
see dead bodies, the cadavers, working on them.
Yeah.
How did you go about that? Like that's like a very hard phase initially for most of the...
It definitely is. Especially, so what they do at KCMC is they cover the cadaver in 3 layers of clothes, so that you remove the first layer, your fear starts reducing slowly, and then the second layer, and then the third layer. So that fear started, the first day I remember, I was really scared, because in other places they use dummies, but in our setting in East Africa we use real bodies, real dead bodies, packed with formaldehyde for preservation. So I remember I slept very long the first night because of the side effects. But it was scary. At the same time, it was very interesting, when you pick the scalpel and when you are doing the dissection, you feel like, wow, I'm doing medicine now. It's not a cockroach like school or lizard, etc. It's you're doing something. So it was fun.
Yeah, that's I remember as well, mashallah.
Yeah.
But
in Dubai you had real cadaver.
So we had what we had. So first wasn't just a body. So the first time we entered, there was a head. I remember that was cut in half.
Really?
It was put there, so you see the lateral view, and there were small body parts. So which body part do you feel like you can relate to? Like what organ do you feel like when I saw this, like it was a bit weird for me, it was a bit hard, or I was like,
I think the abdomen for me, when you open up the intestines, that sight is not very pleasant. Yeah.
And then you finished medicine and you mashallah, persevered and you did really well. Then you went into psychiatry, which is a
Yeah.
very not common
Yeah.
field, especially in Tanzania.
Not a common field, because main reason, at KCMC we had, and it's very important that sometimes a teacher can really inspire you into doing something, into pursuing something, and sometimes a teacher can really discourage you from doing something. So the encouraging part for me was we had a very, very good psychiatrist. He passed on, the late Dr. Ringo. I remember he was an amazing psychiatrist. He was like a father figure to us. The way he taught psychiatry was very different to the way other doctors were teaching at the time. He really connected with his students. He inspired them. He just wasn't a teacher. He was a mentor. Yeah. And that really inspired me. And then I remember I was telling my housemates as well that I really love psychiatry now, because initially I wanted to become a pediatrician.
Mashallah.
Yeah, this is true story. When I started first year, when my family members in Dar, before, like tomorrow I'm going to Moshi KCMC, my family members gathered and it's like, Imran, listen, you're going to become a doctor, make sure you specialize. And I'm thinking, I have not even started day one of medicine, let me start. And it was ingrained in my head that I really love pediatrics and I want to become a child specialist. However, when I entered the neonatal ward in the third year, and you hear the crying of all the children, and you can't even talk, you can't hear each other, I said, no, I don't have the patience for this. But psychiatry was something that I think the teacher was the one that inspired me into becoming one. And of course, the support from my colleagues as well at KCMC, there was a lot of bonding we had as well, mixture of musty and learning as well. I think that also when I took counsel to them and when I was talking to them about psychiatry, they were also encouraging about it.
As I asked about the psychiatry, doing such a field must have been like really challenging. First, it's not like you see the patient, you can see a broken hand,
Yeah.
or you can see a swollen thing or a mass,
Yeah.
or you can see like
There's no X-ray or
there's-
CT.
Yeah,
Yeah.
there's no like radiologic or
Yes.
diagnostic factors you can diagnose with just by
Yeah.
looking. So
Yeah.
you must have like a really hard time, or maybe you enjoy it. Like first
Yeah.
you said you like pediatrics. Like pediatrics,
Yeah.
same thing. The kids wouldn't tell you. I say my chest
True.
is hurting.
True.
So when you chose such a field,
Yeah.
they must come with a lot of challenges and a lot of.
It does. I remember my first day in Nairobi, the first week. Oh, I can't forget the first week, because as you know, in med school, we're not really trained in psychiatry. We rotate like 2 months, 3 months maximum, and we just want to pass the exams. First week, I get major depressive disorder. I get generalized anxiety disorder. I get PTSD, and I'm totally confused. And I don't know the medications. It was really. So what they do in Nairobi is they put you in the deep end from the first week. So you're really reading a lot the first 6 months, because you don't want to embarrass yourself in front of the patients. Every time you're talking to the consultants. So the first 6 months they put you in the deep end, and you're really, really studying every day. You're trying to get through the latest interventions, treatment, modalities, etc. So it's difficult because we see quite a number of cases, from children with ADHD to adults with psychosis like schizophrenia. They have hallucinations, they hear voices, they have visual hallucinations, they see things, they have delusions, delusions which could be paranoid delusions. They feel that they have a fear that somebody is after them, trying to harm them, as you're well aware. Delusions of grandiosity, they feel that there are somebody big. I remember in my second week, I remember this man came, and he had psychosis, he had bipolar mood disorder, and he said, "Hello doctor, I am Prophet Musa, Prophet Moses, and I've come here to save humanity." And I look at him, I said, "Okay, you're very welcome." He's like, "Yeah, and I've split the sea into 12 parts, and me and my companions have come. As you can see, all of them outside are my companions." And he's pointing to the patients waiting outside. Yeah, these are all my companions. So I don't know what got into me. I just said, Prophet Musa had a brother called Harun. Do you have one? He's like, "Yeah, but he was disturbing me. I had to leave him at home." So these delusions of grandiosity, you find them with people with psychosis like schizophrenia, as you know, bipolar, where they feel that they are either in communication with God. God is talking to them directly, and they are a vessel of getting that message from God and delivering it. Or, for example, they are very rich. So these are grandiose delusions of grandiosity. So we see them a lot as well, quite common in certain conditions. And then you also have anxiety. You also have these are the fun things that maybe you can smile a bit when you are treating. But then the other aspect, when you see a major depressive disorder, when you see post-traumatic stress disorder, when you see anxiety, because a number of military people, they come who have witnessed in the war zones, and it's really taken a toll on their mental health. I remember there was a chef who was taken to a war zone, and his job was to cook for the military people, but every day he's seeing in the table there's two people less and less. He's creating bonds with people, and tomorrow, within 24 hours, they're no longer alive. And the bomb, the voices and the noises of gunshots, etc. And he comes back to Nairobi. It's been a week. He can't sleep for more than 2 hours. His eyes are dead, shot red, and he can't get sleep. He can't focus. He can't concentrate. He is having memory issues. He's getting flashbacks. He can't eat. He's just, he has tremors. So these are PTSD. We see quite a number of patients who have that after a certain tragic event. So when you see that, it takes a toll on your mental health as well. When you go home, you also need to de-stress. That's also important.
So I was going to ask, a lot of people say when you spend time with someone for a long period, you tend to become a bit like them. So you having spent time with a lot of psych patients.
As you can see, but it's quite a fun field, but you need to de-stress.
How do you de-stress? What are your techniques for de-stressing?
So you said majlis, like 50 of them. No. So FIFA is one that I learned from KCMC from my friends. So that's one, but I like reading as well, various things. I like watching certain documentaries. I remember I watched some of your videos as well for the Real Talk. So just watching stuff, reading stuff, I think that's one way of de-stressing. I
feel like we're blessed, alhamdulillah, to have Islam as well that guides us in such a good way. And there are different ways.
True.
But doing this field, like you say, you meet people with all these things. There must be some people who are dangerous because they're not like in their senses. So do you ever feel like you come in harm's way sometimes, or someone might threaten you, or like you're scared?
Yes, I remember an incident. This was Muimbili during my internship. So there's this woman, let's say you are the patient, this woman who comes in, and I'm here, and the door is behind me, right?
So this is like in a prison, or?
No, it's in the psychiatric OPD, outpatients, So there's a patient here, I'm sitting, there's a door here. And I'm asking the patient, okay, how are you? Tell me about what brought you here. And she said, now she's around 40 at the time, 40 years. She said, I'm hearing voices. So I asked her, how often are you hearing these voices? And she said, every day. I said, okay, how long has it been? She's been like 2 years now. Every day I'm hearing voices. I said, is it increasing? Yes, it's increasing. Then I asked her, when was the last time you heard them? She said, right now I can hear them talking to me. So I asked her, what are they telling you? And she looks at me without blinking, and she tells me, they're telling me to kill the doctor in front of you. And as men, we tend to show ourselves as we are very strong. But in such a situation, there is no strength that works. So as soon as I hear this, at that time there was a button under the table.
A panic button.
Yeah, panic button. There's no electricity. So I'm pressing for 3 minutes, and I'm pressing. And I realize the fan isn't working. There's no light. There's no electricity. And no one's coming. The askaris are moving behind me. They're just walking normally. No one can hear anything. And what I tried to do is, there was I tried to look for objects on the table that she might be able to use against me. So there's a pen, and I removed a pen. There's something I tried removing. And then she looks at me very calmly and she's like, but don't worry, I don't have to necessarily listen and act upon these voices. So don't worry, you are safe with me. I said, thank you so much. And I really tried to, keep myself. So but now in Nairobi, for example, we have askaris, we have soldiers, we have people, security guards who are with you full time in case anything happens. People with hypomania, bipolar mood disorders who are very violent, aggressive, they come handcuffed or roped and they come in. And then you give them tranquilizers to calm down. So we see them, but the most heartbreaking ones are the youth now who are into substance use and stuff like that. When it's a youth, it's more heartbreaking.
So now that you brought this up, in our community, let's discuss, us, our community, and there is a rising in this use of drugs. which is causing problems. Like you mentioned in your lectures as well, there is depression,
Yeah.
anxiety, and a lot of the parents or the older people in the community, they don't believe in anxiety, depression. They feel like, this is all in your head, like you're
In
just
your
saying,
head.
or you're trying to get attention.
True.
And these kind of people who don't get the right attention end up going to use drugs and doing this and peer pressure.
Yeah. I think we are also partly to blame. This stigma, as I mentioned, when somebody talks to me, people think, this guy has an issue. He's talking to a psychiatrist. There's something that's wrong. And I'll tell you one thing, this is my personal opinion. I feel whenever you want to publicize something, you want to get something across, it needs to be done in the correct manner, the correct methodology needs to be placed. So for example, when you look at COVID time, I was in Kum at the time, but I know that it was the talk of the town. I think for 6 months, everywhere you go, be it physical gatherings, be it online discussions, be it friend circles, COVID was the talk of that discussion panel, yeah? And people were sanitizing, people were steaming for like 3 hours and then ended up getting bronchitis and stuff. Like people were confused. So there was a lot of confusion and chaos. People didn't know what to do. And there was a lot of talk about COVID. But then eventually, as time went by, people realized that, look, COVID is here to stay. So what we need to do is let us take the necessary precautions, but we can't keep ourselves locked in our houses. We have expenses to cover, we have things to pay for, we have a family to look after, we have food to put on the table, right? So people realize because it's here to stay, let us not overhype it. I feel right now the problem with mental health is sometimes some of us overhype it. We overhype it, mental health into people's mind to the extent that people are now, they just no longer sensitive towards it. They're like, we've been hearing mental health every time. I think mental health publicity needs to be done in the right manner. That's one.
So do you feel like the publicity is there?
The publicity is there, but I think sometimes it becomes over publicized, and it's when you shove something down somebody's throat,
So many times.
it becomes difficult to digest. That's one. But I also feel it's our duty and our responsibility to try and educate people, about mental health. People don't know the difference between psychologists and psychiatrists. There's still that lack of awareness about mental health.
So if you could tell us briefly the difference between a psychologist and a psychiatrist.
So a psychologist is trained mostly in talk therapy. A psychologist would sit down with you and using talk therapy and other forms of psychotherapy like cognitive behavioral therapy, etc., try and fulfill the objective that is there based on your condition. A psychiatrist is a medical doctor who has specialized in mental health and can therefore prescribe medications like antipsychotics, mood stabilizers, tranquilizers, etc.
And procedures, you do the procedures as well, the electrocutive.
Yeah, we do the ECT, electroconvulsive therapy, we do them, unfortunately.
And it works really?
For some, yes, for some, no.
So it's still being used?
It's still being used, yeah.
It's not a torture device?
No, it's not a torture device. But and there are a couple of youth who have also come in that needed the electroconvulsive therapy. As you said, youth are into substances now. And I'd mentioned it, and I truly believe it really stems down to upbringing, because nowadays parents don't keep a tab on where the children are going. I remember when I was young, there used to be this gaming cafe. They used to have PS, you have PS, I think 2 or 3, and you play FIFA. So I asked my dad once, can I go? I really want to go. So he said, no problem, you go. And I taken my younger brother. We were playing, and I didn't know my dad had actually come into the cafe, just looking at us for 15 minutes, making sure that I am where I said I was,
It's a good
and looking at the environment, and he goes away. And then I came to know at home that he was keeping tabs. I remember even one day boarding house, we'd gone to play a certain sport, and I came back home. So my dad always asked me, how you going, how you coming back, etc. When I came back home, I did ask, how was it? I said, yeah, we played football, it was nice. He's like, yeah, but there was one guy, he was very abusive during the sport, and this happened, and this happened. And the way he described it, it was so visually accurate that you had to be there. You couldn't have heard it. And then I came to know that he had actually come into boarding house with his bike, come to see me for 15-20 minutes and gone back. I think in the current situation, I've seen so many cases whereby parents give their children so much money, and parents are so busy with their work life that the kids are no longer have that connectivity with the parents. Imam Ali alayhi salam has a very beautiful hadith in which he says, "Innama qalbul hadathi kal ardil khaliya." In his will to Imam Hassan, he says, "Verily, the heart of a youth is like a fertile land or soil. ما ألقي من شيء قبلته. Whatever you put in it, it accepts. So if you're putting a seed of fruit A, you won't get B in return. You will reap what you sow. So I think that's a very important hadith that we keep in mind, that these children of ours are our futures. We need to connect with them. We need to have a jolly nature. We need to have an accepting nature. Corporal punishment, excessive violence doesn't work with children in today's time and age. And the problem is this: when if parents are not connecting with their children, are not sitting with them, are not having one meal every day, as I mentioned, the problem is that those children now, they try to find this connection elsewhere, and they try to talk, because human beings are social creatures. We need to vent out. We need to vent our stresses out. So instead of telling their parents or somebody who is a professional or somebody known in the community, they'll end up telling their friends. And not all friends are going to give you a good advice. So it's very important for parents to, chill and relax a bit and connect with it, get to know their children more about their lives.
So let's say if I'm a youth whose parents are not really, like, let's say, for example, if my parents are not close to me,
Yeah.
or let's say we see nowadays, unfortunately, that the parents are not together anymore. The youth is stranded in a middle place. So as the youth,
Yeah.
what can I do if I'm watching, for example, this podcast and I know, okay, that's me.
That's a
Before I
very
get
good-
into any what can I do?
That's a very good question. I remember recently, there's a 13-year-old girl in Nairobi. Her mom brought her. The chief complaint is that she is talking to an imaginary person. This is a 13-year-old girl. The mother says, I am in the kitchen and my daughter is sitting on the table and there's nobody, and she's laughing. She's actually having a conversation with somebody. She's like, no, I don't think so. I think maybe we go tomorrow. She's having a conversation with nobody. Further probing, we found out that there was mental trauma. So the father was very abusive to both the mother and the daughter. They separated. There was a lot of other factors and things going on. And so as a coping mechanism, this young girl now ended up having and cultivating an imaginary friend in her mind. And she actually feels that this person is true. This was a very difficult case. Alhamdulillah, now she doesn't have those hallucinations anymore. But it was a very difficult case. So these things do happen. Sometimes you might not have, might not have a parent to go to, for example. And I think in this situation, I think it's the responsibility of various community and various jamaats as well to organize very informal gatherings and events for the youth once in a while, because you could study in Hausa 300 years. Trust me, you could have 15 PhDs. If that youth does not feel a connection with you, if that youth feels he or she might be judged by you, they will never approach that person. Never ever. Yeah,
So
we'll never
who would be
open
the right person to so let's say we organize a event, okay? Who would be the right people to come as like counselors or people who can guide or mentors for such a thing? Would it be?
I feel, in my opinion, the more informal, the better. Because when you keep it very formal, we now have a psychiatrist. We now have that already creates a fear in somebody's.
barrier,
It creates a fear. Like today also, when people in the Jamaat, they looked at me, Assalamu alaikum, tame su karo cho, psychiatrist, tamati biuchu. So I was like, don't worry, I'm not going to bite. So I think the more informal, the better. So you have people who are professionals in their field. You could have scholars who play with the youth, who play football, who connect with the youth. That's also very important. You have people who are maybe in the mental health professional field, and you can have an informal gathering with them. The youth automatically, once they see that this person is approachable, has a jolly nature, I can actually talk to them. Youth face so many addiction nowadays. You have so many forms of addiction, but they don't have anyone to talk to. So when you have such informal gatherings, it makes a big difference, because in today's time you have, like as I said, 1 in 2 people is a counselor. Like everybody is a counselor. And I have seen with my own eyes that people who identify as counselors end up actually causing so much more harm to that patient. Especially I've seen patients with depressive disorders, and they go to a counselor, and it's not even a counselor. You ask them, for example, where did you study? They'll tell you, I did a 3-month crash course online. That doesn't give you, the liberty to come and say you are a counselor. So people need to realize that when they need help, they need professional help.
So who would be the professional person? A psychiatrist?
So a psychologist would be one. who would be able to talk to you. A psychiatrist would be a doctor who would specialize in mental health, and you involve the religious scholars as well, because there's a lot of things that they can, look into. So you have spiritual doctors and physical doctors as well. So that's very important as well. When you hold on to what the Quran tells you, ask those who know. فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. If you don't know, ask those who know. You hold on to Quran, Ahlul Bayt, and then the right company, the right group, the right friend circle. It's very difficult for you to go astray.
Yeah, it's a very, like, mashallah, thank you. So, as you said, a lot of the boys nowadays, or the girls, or the youth nowadays, I feel like there's a thing going on. So let's say, because I'll spend a lot of my time on social media.
Right.
So majority of us would spend time on social media, do this. But the content that is being relayed to us.
Yes.
Yeah. So for example, let's say I'll watch a YouTuber or an Instagram influencer. They'll be saying, I have anxiety, and my anxiety, this happens to me when I have anxiety. Because of my anxiety, this happens. Or I'm depressed because of this.
Yeah.
And so they mention symptoms that aren't really.
Yeah.
But now because I watch, and let's say they kind of become like a role model to me because I follow them or I do something.
Yeah.
So how would I be able to say, okay, now I have anxiety? Because majority of them say,
Yeah.
I have anxiety now. Oh,
Yeah.
now I have depression. If this person has depression,
Yeah.
I
True.
have depression. I have the same things. And it's not just in anxiety. Many medical
Yes.
like things, they use symptoms as.
Unfortunately, as I said, it's overhyped, which is what my point was when I said that, we are, our methodology of mental health publicity is a bit wrong. And many people tend to come into social media via Instagram reels and say, I'm depressed. Depression is a clinical diagnosis. Yeah, it is diagnosed by either a psychologist or a psychiatrist.
And how
We
would you
have
define
so we have
depression?
tools. So we have tools. So for example, it's a state of you have anhedonia. You don't find pleasure in activities once you found pleasurable. For example, you have loss of self-esteem. Feelings of worthlessness, guilt, suicidal ideations, isolation, etc. We have tools to diagnose them, like the PHQ-9 tool or the Beck's inventory for depression, etc. Same with anxiety. So a psychologist or a psychiatrist will come and give you a clinical diagnosis, because now people coming in the social media platforms and saying I have depression, anxiety is like somebody who's coughed once and said, brothers, I have TB. It doesn't make sense. TB is a clinical diagnosis. You can't just cough once and say pneumonia 100%. No, it doesn't make sense. So we need to be careful where we get our information from. Yeah, that's one. Number two, a lot of these mental health issues stem from upbringing, but also social media. Parents need to be very careful of this amount of screen time that their children are having. Nowadays, I see in mosques, and other centers, parents, in order to keep their child quiet, they just give them an iPad or a tab, you play. Not realizing in the long run that's very disadvantageous, because today when you look at vloggers and all these people who influencers, they're called, most of the things they show you is money, wealth, luxurious car, etc., houses. So automatically in our psychologically, in our subconscious, a youth would think that wealth equals to success. Whilst there are many of these influencers, they don't show you the negative aspects of their life. They don't show you their strained relationship. They don't show you the physical or mental problems they're going through, etc., etc. They only show you the good parts of their life. And youth don't really, our young boys and girls don't really realize that this is just an apparent thing they're showing us, but the reality is something else. So we need to be very careful where we get our information from.
And so even nowadays for majlis, for example, people will say, well, if the majlis is more than 20-25 minutes,
Yeah.
I cannot pay attention.
Yeah.
And if you ask, they say, no, we have ADHD, we can't have a attention span of more than 20 minutes, 25 minutes. Even madrasa classes now should only be 25 minutes maximum.
Yeah.
And they're so
I
adamant
remember
about it that they believe that it's
they
true.
believe that. So ADHD again, attention deficit. So it was called ADD, attention deficit disorder. Later on, they realized apart from being attention deficit, that they can't be attention, they're also hyperactive. So it became known as attention deficit hyperactive disorder. And then later on, even mental health professionals realized they're also very impulsive. They just grab things very quickly. So they're attention deficit, they're hyperactive, but they're also impulsive. So, but this is a clinical diagnosis. And those people who say they cannot concentrate, I remember there was a Maulana a few years ago, he was telling me, he told me that, he said it in Urdu, he said, एक नौजवान मेरे पास आया और मुझे कहा कि मौलाना मैं उर्दू मजालिस मुझे मेरी दिमाग में मुझे समझ नहीं आती जब आप उर्दू में बात करते हो, तो हो सके तो आप इंग्लिश में भी मजलिस पढ़ा करें. देन द मौलाना सेड, मुझे ताज्जुब ये हुआ कि ये सब इसने मुझे उर्दू में पूछा था. So sometimes it's true, we can watch movies and Bollywood movies in Urdu, we understand, but when it comes to the majalis, I mean let's face it, we have watched movies of 2.5 hours
without taking a break.
without taking a break. So I think I think it's sometimes it depends on what are your priorities and your preferences.
Maybe we can say a few might have.
A few could have this problem of attention deficit, but again, I know that majority of us, if we really put our mind to it, we can sit through this. And I'm not saying you sit through a 3-hour lecture or majalis, but I think today, as time, as our generation is evolving, I think many scholars are realizing now that they need to shorten their majalis and their lectures. So I think nowadays most of the places I see 30, 35, 40, which I think is doable.
It's still, yeah. But
Yeah,
don't you
it's
think
doable.
they're using this anxiety, depression, ADHD as a way to bypass what they're supposed to do, or like escape? It's an escape
True.
route. Like I'd rather be lazy,
Yeah.
watch a 1-minute reel, 100 of them,
Yeah,
400 minutes.
yeah, true.
But
I asked somebody, he told me I have ADHD. I said, how do you know you have ADHD? My mommy told me. So, so it's a clinical diagnosis. You know, you can't. It's not like it's passed on. Like, you know, my son, I'm leaving for you ADHD. You give it to your son in inheritance. You know, yeah, it's not like that. People pass money in inheritance. They don't pass ADHD. So it's a clinical diagnosis unless a mental health specialist has diagnosed you with these things. And of course, there's treatment modalities. I mean, you have a psychologist, you have a psychiatrist, you have psychotherapy with medicine, and then the treatment is very much available. It depends on your willpower and how much you would want to gain treatment. But I think it's being misused. I mean, if those influencers are saying that, you know, I have depression or anxiety, what about the children in Palestine then? I mean, can you even compare what we are going through and what they are going through? The post-trauma that they are going through. It's unimaginable. It's
yeah.
unimaginable.
So as we said, you know, they're using this as an excuse to, you know, bypass or get an excuse not to go to majlis or not to attend a long class by saying I have depression, anxiety. But then there are those people who actually do need help.
True.
Okay, I'm not saying it's the majority, but there are people who we see
True.
have either OCD or anxiety and depression. It might still be in the early stages where, you know, it can't get worse, or it can become much better if they go the right help. But again, as there's the thing in our community, he went to a psychiatrist, he must have some mental.
True.
So we have that fear, if someone sees me or if I go, that means bas, I'm done for. Like, we have this understanding that if I go once to a doctor, for example, it's like hypertension. You know, if I start hypertensive medications,
Yeah.
I'll just continue for good. So if I go to a psych doctor, I'm crazy for good now.
Yeah. No, many people even, unfortunately, you have allergic dermatitis, you have skin issues, you have constipation, stomach issues. You wouldn't mind telling people, you know, last night I had diarrhea, I had fever, I had cough, etc. When it comes to other organs, we are very much okay talking about them. But when it comes to the brain, suddenly it's like the brain is no longer part of the body. Whilst on the contrary, it's one of the most, if not the most important organ. So it's something that it is changing. I think it's getting better. That's one. Two, many people call me and tell me I have an issue, psychiatric issue. I said, please come to the clinic. He's like, no, you come home for a house review. And I'm like, house review will cost you more. Like, no problem, whatever the amount. We don't want to be seen entering your clinic. So it's a problem. However, things are getting better. Now, if there's anybody watching this podcast that really is going through, there are many people in our community who go through bipolar mood disorders, depressive disorders, anxiety. Then we have treated quite a number of them. Substance use disorder, etc. My aim of saying that there are certain people taking advantage does not mean that those people who are really in need are not in need. No. So I need to clarify this. What I mean to say is, when you have a depressive disorder or an anxiety or any psychiatric condition, it needs to be verified by a mental health professional. Yeah? A psychologist or a psychiatrist needs to affirm and confirm with you that yes, you have this. This is my point of saying that it needs to be just like you go to a doctor and you get a confirmation of pneumonia or TB after investigations. Same way with psychiatry. So some people skip this phase and they self-diagnose. So when I'm saying people who are taking advantage, I mean those people who self-diagnose. That's the problem. Yeah, it needs to be clear for the podcast viewers. Now, those people who are truly in need, and there are many, truly they are in need, be it childhood trauma, be it certain stressors, chronic stressors, triggers, people are in drug use, people are in some forms of addiction, different forms of addiction, addiction with regards to watching things, etc. And they want to reach out to people. I believe that there are people in each community. We have professionals, we have scholars, we have psychologists, we have psychiatrists. Mostly we have more psychologists than psychiatrists, and they definitely should reach out to these people without the fear of being judged. People who are intellectual, people who are religious, they are friendly, and they will not disclose their secret. Imam Sadiq al-Islam gives these 4 criteria. He says if you want to al-mushawara, if you want to do seek counsel, these are the 4 qualities. You look at somebody who is intellectual, fasalu ahla dhikr, he should be somebody who knows, who is in that field. Number 2, that person should be brotherly and friendly. Number 3, he should be religious. He should not be an open transgressor. And number 4, he should be somebody that doesn't disclose their secrets to somebody else. If you get somebody with these 4 qualities as mentioned by Imam Sadiq, then I feel that is the best person for you to go and open up to. Sometimes children can't open up to their parents, and that's fine, that's okay. But we should never judge. Whenever somebody comes to us with a problem, we should never judge. Because once you judge that individual, or if that individual senses judgment from your part, that's it, you have ruined that person. That person will never go to seek help from other people, and that person will have no other way. And that's why many people have suicidal ideations because of this. There's a lot of bullying going on in our schools. People are being bullied for body shamed because of their weight. I've seen people who have self-injury marks just because of bullying, for example. Attempted suicide, thankfully not successful. But there's a lot of issues our youth are facing, strained relationships, etc., etc. They have tremors, they can't sleep at night. They need somebody to talk to. They need somebody to vent. And we need such individuals in every Jamaat of ours. Some individuals with these qualities that people can approach, people can talk to, but people who are professionals, not just anybody.
So the first step is seeking for help, you'd say?
The first step is identification, is I have a problem, because this is a part of insight. I understand that I have a problem. So that's the first step, recognizing that you need help. The second phase is now seeking help. But more importantly, who to seek help from. And people need to reach out, which is why friends play a very big role. When you have the bad company, when you have the bad friends, and when you open up to them, they end up giving you bad advice that would, worsen your condition. You started with anxiety, and because of your friend now you are in substance abuse. And now you have anxiety, depression, and you are also on drug abuse. And now with one diagnosis you have 3. Just because of bad company. And it's happened several times. Several times.
So let's say I'm watching this podcast, okay?
Yeah.
And I know my child is suffering from these things, okay? But I'm not sure. I can't diagnose them 100%. Can I find a person, let's say I trust, and let's say that person is a Maulana or something?
Yes.
Would you suggest the Maulanas to be in touch with someone like you, a psychiatrist, and you can work hand in hand to help the people in the community? Or how would you suggest, for example, let's say in our Arusha Jamaat, we don't have a psychiatrist.
Right.
Or a psychologist.
Yeah.
So who should they approach, for example, in Arusha Jamaat?
So in Arusha Jamaat, for example, I remember Africa Federation had a VSS platform, virtual safe space. But there are many people that you can. So for example, it has to be a combined effort. It's not only scholars, not only mental health professionals. It has to be a combination effort. Because scholars alone might not be able to help, and psychologists alone can't do, psychiatrists alone might not be able to. It has to be a combined effort. So I believe we have people from other Jamaats who might be able to do virtual and online assistance. That's very much possible. But, I always feel prevention is better than cure. If we can prevent these things, if parents can be more connective with their children, parents can keep tabs who they're going out with. If our youth realize that the Prophet says that Al-mar'u ala dini khalili, falyandur man yukhalil, that a person is known by his friend's creed in religion. So, you look at who you are befriending. If we can have these preventive measures, I have coined a term today, as I told you. It's called OMED. We have the OMED diet, 1 meal a day. Inshallah, we pray our viewers as well, they also become fit like me and you, for those who are doing diet. But apart from the OMED, I don't know why you're laughing. apart from the OMED diet, there's something I've termed, it's called a Dr. Imran 2024 trademark. So you can't, they can't steal it. Yeah, it's a trademark. It's called OMED. OMED means one meal every day together. If parents can sit down with their children, and I know breakfast is difficult. The parents are at work, maybe the child is at school. Lunch is the same. Dinner is a possibility. Sunday breakfast is a possibility. Sit down. I know many youth who just take the food, go into their room. And they are the ones who will most likely end up in these mental health issues and trauma. But those parents who, instead of using their phone, the father is on Instagram, mother is on Facebook, the child, God knows which website is going to, it doesn't work. I mean, you are sitting on one table, but there is no connection. If you can follow the OMET, one meal every day together, as much as possible, you will see that the child will develop such a bond and connection with the parents that he will eventually open up to their parents. And there are people who really discuss everything with their parents. We have individuals who tell their mom everything. We have individuals who can have an open discussion with their father. How do you think this connection happens? It doesn't happen by asking the child, how are you? How was your day? Okay, Alhamdulillah, Khudafiz. No, it happens when you sit with them, when you spend time with them, when you genuinely want to know more about their life, about their day. That is when they feel that, no, this parent of mine is really interested. He's worried about me. He cares for me. And therefore, I am very much comfortable to opening up to him. That is when parents are successful. That is when truly a lot of these, and I'll tell you, if you ask me in one word, what is the cause of majority of mental health issues in adolescents and youth? I'll say it's tarbiyah. It's upbringing. If this can be sorted, a lot of our issues in the future can be sorted.
You said tarbiyah.
Right.
The 4 qualities you mentioned. Should all the parents have these 4 qualities that you mentioned of being a friend?
True. Yeah, I mean, parents need to be open with their children, have open communication, make them sit down, ask them about the day. Nowadays, parents will come, many of them will come, how was your day? Alhamdulillah. Good? Any issues? No. Okay, that's it. But that's not connection, yeah? If you can spend time with them, quality time with them, that's one. And number 2, have a friendly nature. You know, I've seen parents, the child does something small and then they're grounded and I don't know, they are taken out of the house the whole night, you're sleeping outside. It's like a very aggressive approach, a very violent and harsh approach towards the child. So what you're doing is, you're putting fear in the child. The child will never open up to you because he has this fear. If I say this, my dad will judge me, he will kill me, he'll beat me, he'll ground me, he'll take away my PlayStation, he'll do this. And that is why many times children therefore don't open up to their parents because of the fear of the outcome. So parents, really, teachers as well, we really need to have a very friendly personality, have more informal gatherings with the youth as opposed to formal. So really these steps really do help with.
So do you think we should have maybe a training session for parents as well, where parents are trained?
Tarbiyah workshops, for parents, for teachers, on identification of red flag symptoms. What are the mental health symptoms that you can see and notice in a child that there's something wrong and we need to seek help? For parents, on the methodology of doing tarbiyah. What's the best way of doing tarbiyah? I think that's very important for parents to learn as well.
And as you mentioned earlier, that we claim that we may have anxiety and depression, rightfully so, we might have, but the brothers and sisters in Palestine who are actually going through, I don't even think it's PTSD, it's current traumatic stress they're going through because it's non-stop.
It's non-stop, it's continuous traumatic stress,
And for them, what kind of help is going on? And we're really fortunate to be able to,
We are truly, truly fortunate, and I'll tell you, really, we don't realize how lucky we are to have our mental sanity with us. Imagine you see your son dying in front of you, you watch your parents bombed and die in front of you. You are a mother, you are carrying the body of your son in your arms and as he's losing his life. Really, when we look at these scenarios, it's really heartbreaking, and we realize what we are not going through anything like what we are going through and what they are going through. It's with nothing. It's not even an iota. But sometimes one thing that baffles me, it really baffles me, this one answer in history baffles me. Till today, I don't know. I don't have an explanation for this answer. You are a woman who has seen your own brother who is an imam, whose body you have seen dismembered. You have been taken as a prisoner from one place to another. Your veil has been snatched away from you. Your apparent izzah has been tried to taken away from you. You have been beaten and lashed on the way throughout. And when you are asked, كيف رأيت صنع الله على أخيك وأهل بيتك, how do you find Allah in all this? And when you say ما رأيت إلا جميلة, I find nothing but beauty, there is no answer to this question, and it baffles me. You know, sometimes when you look at people with this, and this is what the willpower that the Palestinians are having, you know, they follow the slogan of Imam Hussein, who says, Inna da'i abna da'i qad rakaza bayna thnatain. I've been left with two options, bayna sillati wa dhilla wa hayhata minna dhilla. I'll never be humiliated. And I think that is Karbala has become such a big inspiration for us, that the Palestinians today are a living example of that objective of Imam Hussein alayhi salam. So I feel that we are really, the mental stress that we go through in our day-to-day life, I have no idea, and I can't answer your question. I don't know the trauma that the Palestinian children and women and men are going through. I don't know. I really don't know. But I just feel when you have Allah with you, and the Ahlul Bayt have taught us, when you know you are on the right, then regardless of what happens, you know that there will be a day of accountability. You know that there will be a day when the Madhlum will be called forward and the Zalim will be called forward. You know, there's a very interesting hadith for the Prophet when he says, on the day of judgment, Allah will say, Ayyuhal madhlumu taqaddam, or the one who is oppressed, come forward and speak. Ayyuhal zalimu la tatakallam, or the oppressor, don't speak. And I think when you realize that, when you have this understanding that I am a madhlum, but there is a day when Allah will take care of the zalim. There will be a day of accountability. There will be a day when I will get my right. And I think that willpower and that understanding really keeps you going. Really keeps you going forward. And I don't want this to be a majlis podcast, but there's a very interesting hadith as well when it comes to the oppressor and the oppressed. You know, one day the Prophet is seated with his companions, and he asks them, Atadruna manil muflis? Do you know who a bankrupt person is? So the people give the same reply that you and I might give. They say, Al muflisu fina man la dirhamu lahu wa la dinar. A muflis, a bankrupt person, is that person who doesn't have money, no dirham, dinar, no shillings, bank account zero, drowned in debt. The Prophet says, no, la. Innal muflis min ummati man ya'ti yawm al-qiyamah bi salatin wa siyamin wa zakat. A true bankrupt is that person. On the day of judgment, he'll come with mountains of good, with salat and zakat and khums and charity and prayers and fasting, etc. So the people ask, Ya Rasulullah, how is that a bankrupt person? I mean, he has a whole mountain of good. The Prophet says, no. وَيَأْتِي وَقَدْ شَتَمَ هَذَا وَقَذَفَ هَذَا وَأَكَلَ مَالَ هَذَا. He says, a group of people will make a line. Ya Allah, he did my tuhmat, he did ghibat, he hit me, he oppressed me. And now the madhlumin will make a line and say, Ya Allah, we have been oppressed. So now what does Allah do? يُعْطَى مِنْ حَسَنَ هَذَا مِنْ حَسَنَاتِهِ وَهَذَا مِنْ حَسَنَاتِهِ. Allah will say, okay, you see this mountain of good. Now, according to his dhulm level, slowly give them. Put it in their accounts. But the Prophet says the story isn't over. Now, half of the line will finish. And when that half of that line finishes, his entire mountain of good is finished. But the line is still there. People are still waiting, Ya Allah, his good is over, but he still did wrong to us. So Allah says, فَيُعْطَى مِنْ سَيِّئَاتِهِمْ فَيُطْرَحُ عَلَيْهِ. So Allah will take their bad deeds and put it in his account. So that man, that zalim who came with a mountain of good on the day of judgment, will live with a mountain of bad, فَيُطْرَحُ فِي النَّارِ. He'll be thrown face forward in the fire of hell. If we have this realization that there is a day of accountability, and I think that is what is keeping the Palestinians and all the oppressed people in the world moving forward. There is a day that will be our day.
So that was really beautiful. I feel like what you said also for us here who are like going through, let's say, whoever has anxiety, depression, if we do believe that there's a day of accountability and we believe that, Allah is there. And I think one of the Imams has said that if you left me all alone in the world,
True.
and the only human being,
True.
which you just gave me the book, the Quran.
That's it. I
don't
don't need anything else. True.
So this shows us that, in Islam, that we have ways and we have a system, a way that prevents us. Like you said, prevention is better. Yeah?
True.
We have a way that prevents us from falling into these things. And Hamza, as you can see in Palestine, recently we heard the story of the father who went to get the birth certificates of the two twins. Imagine you're a doctor and you are a doctor, and the father comes to you and he's like, I just lost my twins and my wife. I just brought their birth certificates. And as a doctor or as a psychiatrist, how would you even talk to such a person and be like, let's do speech therapy. Let's start by talking about it. Like, where would
I can't. I don't know how to answer this question. Wallahi, I don't know. Really, I don't know how I would approach him. This is one question I can't answer. I really don't know. I really don't know, because it's so easy for me to say that I will talk to him. I'll make him sit down. I'll tell him, I'll give my condolences. It's very easy for me to give you the book guidelines, ABC. But when you're in that situation, really, it's very difficult.
Like, as a psychiatrist, not just in these situations, you must be very strong in your iman as well. So when you talk to such people, you don't get carried away, or you don't, you have to be
you
firm.
You try to be firm. Allah helps. I mean, it really, Allah helps, but you try to be. It's not easy. The number of, with psychiatry, you have those fun cases, as I mentioned in the beginning, but you have those really heartbreaking cases. And you really need, when you come back home, sometimes you can't even sleep at night. You're just thinking of what you saw and what you heard. You have people like gender-based violence, women being abused physically in such an inhumane way that when you come home, you can't do anything. You can't eat, you can't sleep. So it's not easy. This route of mental health, it's not easy, because you come across a lot of things that, and you're doing your best to try, because with psychiatry, the treatment takes time. It's not just one day. It takes some time for the patients to recover, but it takes a toll on us as well.
So let's go a bit on a lighter note. Maybe I'll ask you this question. You said, there's a lot of things you've seen. Which is your favorite case that you've seen? Like the most fun case that you have as a psychiatrist?
The most fun?
The most fun that you really enjoyed. Like this I can never forget. Like it.
This is like asking an oncologist, what's the most fun cancer you have seen?
So like, how you said the patient who came and said he was Prophet Musa. That was a bit of a...
that was... let me think back. KCMC... No, so the KCMC fun moments were in the in-house moments.
Maybe you can start with the KCMC. Because again, studying medicine is also like, it's got its own toll. And you must have had, like you mentioned, you had such a good group of friends and brothers
amazing,
that you could keep with each other together. And you must have had a lot of fun moments. Maybe you can share even a few of those that can...
Those light-hearted moments, they were. So there was this one doctor friend of ours. His parents were coming to visit him. And, when you put 5-6 bachelors, 18, 19-year-olds in one house, it's chaos. They used to call our house Baytu Iblis, house of Shaitan, because there was one day, it was weekend, it was a Sunday, and our house was in such a mess, like the sofas were blocking the main door. There was boxes here and there. There was an old, I can never forget, there's an old person who came, elderly man, he came to us and he looked at us and he said, Tamara gare to malakul mote na aave. So I said, Kim, he's like, where will he pass? There's no place for anybody to pass. So I remember one of our housemates, his parents were coming to visit our house. Now, I don't remember whether he knew or he didn't know, but I remember we had 20 minutes before to clean the house, because his parents are coming to see the house. And I remember I told him that, look, brother, if your parents come and they see the house in this state, the least thing they'll do is they'll disown you, for sure. This is a guarantee. So let us clean the house. And that was the most fun we had. Socks in the microwave, clothes in the fridge, I don't know, our books in the freezer. Wherever we found a place that, things are under the bed. It was those 20 minutes I can never forget. There were quite a number of fun memories and pranks that we used to play on one another, We remember, there was a real incident of theft at our house. Thieves had come in at 2 a.m. and my laptop was gone, and other housemates' phones, etc., watches, etc. So they hadn't entered, they came through the window and they put a broomstick through the window to take these things. So the next day, and we have a video of this, the next day we went, our colleague is sleeping, and when he watches this, he knows. He will know, this respected doctor will know who we are talking about. And he's sleeping, and we take a broomstick from outside the garden and we are trying to, poke him with it. And he suddenly turns into Hulk mode and he goes and he comes out and tries to beat. We got beaten that day. Yeah, he really beat us that day. But quite a number of fun memories at KCMC. When it comes to psychiatry, there are so many cases that, as you say, the fun cases that would put a smile to your face, like the Prophet Moses incident. There's quite a number of them, and I can't even really think of it right now because most of them are now with depression and PTSD and anxiety. Very few are those ones that make you happy and give you a good time. But there are many, especially those with delusions of grandiosity. People who will come and say, you know what, I'm the president of this country, my GDP, I have more money than Kenya's or Tanzania's GDP. And when you strike a conversation with them, the more you talk to them, the more they increase their grandiosity, the more they say that they're a big person, etc., etc. So such cases are, but you don't get time to talk to them so much because there are so many patients that you need to see that you need to be very quick, especially because where I work at is the National Mental Health Hospital for the entire Kenya. So you have patients coming from all across Kenya, from Naivasha, Mombasa, etc. So you need to be very quick.
So you have like a specific amount of time, like limited time?
No,
They give you a time limit?
They don't give you a time limit, but when you look outside and you see 300 patients and you want to go home, you will try your best not to waste time. Be on point and continue with the treatment.
So let's say your timing is, let's say, from 8 to 5, for example, and it's 5 o'clock and you have patients outside. Can you just leave?
You wait for the other doctor to come and relieve you from the shift. Otherwise, it's better you say. It's ethical for you to stay, so you don't leave the patients without a doctor.
And that is like a really beautiful answer. Thank you so much for blessing us with your presence in this podcast.
Thank you.
Maybe you can give us just advice a bit. I'm a student, for example, or I'm in O-levels, A-levels. You said many people are confused. How would I know the best way? So you have done Hausa, you've done medicine, you've specialized in psychiatry, you've studied Arabic, you've studied Farsi, you're a Quran competition, and as you said, you used to play FIFA. I don't know how good you are, but it's also a career nowadays.
I would say the FIFA comes at the top of the list. Yeah.
And then you recite Masha, Matam, Mashallah. You do everything. You're a master of all trades. So if you had to give advice to someone, maybe a parent or a child who's coming up, or a parent who's bringing up their child, maybe even 50% of what you are would be.
Yeah, now butter is expensive nowadays. I don't know about Arusha, but in Nairobi it's very expensive. If they are unsure or unaware of what they want to do, you mean career-wise?
Career-wise.
I think I can't talk about other careers, but as a doctor, you being a doctor as well, I think, and I truly believe genuinely, if you don't have the passion for it, it's going to be such a nightmare for that person, because you need to have that willpower to pick up the phone at 2 a.m. and look at the emergency and attend to it. It's not easy. It's not easy. If you have the passion for it, then definitely. But if there's no passion for it, it becomes very difficult for somebody to become a doctor. I know many doctors who now, they've finished their MBBS, their medical degree, but now are into finance and business, and they've ventured into other things because it just wasn't for them. So I would advise these O-level or A-level students to maybe sit with a doctor in a clinic, get to know what a doctor's role is, get to know what is the studying part, how it's divided, how the 5 or 6 years are divided, and what are the expectations of a doctor. And that's what I did. I remember when I finished O-levels, I went to work in the pharmacy. I volunteered, and then I also sat with a few doctors in their OPD, in their room. They allowed me to, and I was seeing some of the cases, tonsillitis. They were showing me that this is how the tonsils look, and so I had that interest from them. So I feel that if you really want to do medicine, I feel take a trial of a month and look into a hospital setting and see what it entails before going into it.
So that's a really beautiful answer. Once again, thank you so much for blessing us with your presence.
Thank you so much. Thank you so much for having me.
I feel really honored having someone like you.
Pleasure is mine.
A role model, mashallah, if I must say.
Pleasure is mine.
Blessed us. And inshallah, we can have more sessions, but I'm sure you've not even touched a bit of what you've had to say.
Inshallah, yeah. If the hadiah is in pounds, I'm joking, of course.
The hadiah will be according to the number of likes.
Of the number of likes. Oh wait, I have got a very big family. No, thank you so much. The pleasure is mine. I think it's good to have such conversations, and if it's beneficial, then Then yeah, thank you so much for having me. Truly, the pleasure is mine.
Son, thank you so much.
Asante sana.
Inshallah, remember us in your
Thank you.
du'as.
Inshallah,
And
you too.
inshallah, if we have any problems, I'm sure to all the youth out there,
Yeah.
you can get in touch with Dr. Imran. I'm sure he'd be willing to
Of
help.
course, yeah,
If
if you
anyone
need-
like who needs help, or you can get in touch with us, and we'll be very, very happy to connect you to Dr. Imran and help. And not just youth, anyone older, younger, would be like ready to help, inshallah.
Yeah.
You can contact anyone from the YDC, any of your friends feel like, or you know someone who might need help, please feel free, and we'd be willing to help. And once again, thank you so much. Thank you for watching the episode by Real Talk, done by YDC. Asante ni sana, karibu, hadi baadaye.